Hey guys, today I'm going to talk about oral hematoma, which presents itself as a swollen, blood-filled, painful ear. Oral hematoma can occur due to excessive ear scratching or head shaking. Blood vessels in the ear burst and blood collects in between the cartilage and the skin. Oral hematoma often occurs secondary to an existing ear problem such as an infection or a grass seed in the ear. Simple hematoma can be drained using a needle and syringe. However, the hematoma can come back and a second draining may be needed. Serious hematoma may need surgical draining, where a cut is made in the center of the ear to drain the blood and stitches put in to stop the ear from filling up again. It is important to resolve the existing ear problem to stop oral hematoma from coming back. For more videos, please do visit nickfowland.com.